Hi, and welcome back to Psychology with me, Mr. Snyder, and today we're going to be continue our discussion of psychological disorders with talking about eating disorders, schizophrenia, and personality disorders. So, eating disorders, obviously we've learned about these in health class before, but they are classified in the DSM as well. Eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia is not eating. Reduce eating to the point your body weight is significantly lower or less than minimally expected. If we're talking about adults, we're talking about a BMI of less than 18.5. Bulimia is binging, which is overeating enormous amounts of food and then using unhealthy methods to avoid weight gain, most often purging or making oneself vomit in order to discard the food. And then binge eating disorder is eating large amounts of food in one sitting without purging. The causes of eating disorders, basically someone who is young, an adolescent or a young adult female, although it does happen to males too, especially if the male is in some sort of profession where their weight is important, such as like wrestlers or boxers, models. This happens too. Causes may be an increased sensitivity to food, and its reward value may play a role in bulimia and binge eating disorder. And in anorexia, fear and anxiety are associated with food, or they may become associated with food, which means that we do not want to be around food. Moving on to schizophrenia. Schizophrenia is a pretty severe disorder. It's one of the most severe out there. The person suffers from disordered thinking, bizarre behavior, auditory and or visual hallucinations, and the inability to distinguish what is real and what is not. And that's really the key symptom there, is the last one, the inability to distinguish between fantasy and reality. Some symptoms of schizophrenia may include a psychotic disorder, cannot separate what is real and what is fantasy. So person hears a voice, they may think it's real. We all have voices in our heads, don't we? You know, it's called intuition. You're talking to yourself, you usually hear that voice. You don't see words of yourself talking. You hear yourself talking to yourself, but a person who is schizophrenic may not know that that is not real. Delusions are also a big symptom of schizophrenia, and delusions are false beliefs. So hallucinations are seeing something or hearing something that is not there and is not real. Delusions are false beliefs held by the person that are not real. So there's 4 different types we're going to discuss. Delusions of persecution means that the person believes that somebody is trying to harm them. Delusions of reference means that they believe that people are talking to them specifically. So the person on the radio, on the television, book characters are referring to them specifically. Delusions of influence means that their actions are being controlled by external forces, sometimes the devil, aliens, and delusions of grandeur. Grand meaning grandiose, meaning that the person believes they are more important than they actually are. They are the chosen one. They are on earth for a special mission, and they have the ability to save the world or otherwise preserve mankind. Another one is speech disturbances. Clanging would be stringing words together on the basis of sounds, saying words that rhyme or have the same beginning or end sounds just because they do. So you end up with a mixture of words, and that could create a word salad, which would be expressing yourself in a meaningless and jumbled mixture of words and phrases. We already talked about hallucinations, which are false sensory perceptions. Hearing voices that do not really exist is a dangerous one, because you can't really turn it off. I mean, if I see something that's not there, I can always look away. There's also tactile hallucinations, where the person feels they're being pinched or poked and feeling stuff on their skin that is not really there. And then flat affect. We talked about affect meaning emotions. This person does not have emotional responsiveness. Some other symptoms of schizophrenia, one more is catatonia, or if somebody is catatonic, that means they are going from a statue-like immobility where they hold uncomfortable positions for a long time to bursts of energetic, frantic movement and talking at that point. So this could be hours on end between switches, but that's catatonia. And then some people describe symptoms of schizophrenia and they classify them into positive and negative symptoms. Positive symptoms being the excesses of behavior, which would be things that they're seeing, things that are added in, like hallucinations, delusions, and distorted thinking. Negative symptoms are symptoms that are less than normal or absence of normal behavior. So the poor attention span, the flat affect, and the poor speech production. Causes of schizophrenia, we're still really not sure. It's still a disease and a disorder that a lot of people, that doctors don't really know a lot about. It's more than likely a combination of genetic and environmental factors, and the most popular way of describing it right now is the stress vulnerability model, which means that a person is born with a biological sensitivity to a certain disorder. And that doesn't mean that the person will develop the disorder per se, but they could develop it if they are under the right conditions in their environment or emotional stress. Here you can see there is genetics involved in schizophrenia. It seems the more related you are to someone, that the more possible you are, the greater possibility you are to have schizophrenia. Monozygotic twins or identical twins are 48% chance that they will both have schizophrenia. Why 48%? Why isn't it 100? Because we know that it's not only nature, it is also nurture that can determine if a person has schizophrenia. Personality disorders are kind of a little bit different than psychological disorders because psychological disorders come in waves. We have good days, we have bad days with the disorders, but in personality disorders, it's kind of a persistent, rigid, and maladaptive pattern of behavior that you're stuck with. It's just kind of the way you are and kind of the way you behave. The main emotion is anxiety or fearfulness, and the behavior of the person is very dramatic, emotional, or erratic. And there's 10 different types. I'm not going to have you learn the 10 different types. We're just going to focus on a couple here. ASPD, or antisocial personality disorder, is when the person uses other people. They don't worry about their rights or their feelings. They couldn't care less if the person gets hurt. And they usually behave in an impulsive or reckless manner without regards to the rights of society, the rules of society, or the rights of the people in society. And they don't care about the consequences. More males than females are associated with ASPD. And the majority of these people are not psychopathic. Which means it's not a mental disorder, but it is a rigid personality pattern that they're stuck with. Borderline personality disorder tends to affect women more, and it's a maladaptive pattern where the person is moody, unstable, lacks a clear sense of identity, and often clings to others with a pattern of self-destructiveness, chronic loneliness, and disruptive anger in close relationships. So there's extreme swings from idolizing the person to demonizing the person, to idolizing them to demonizing them. The emotions that the person shows are often inappropriate and excessive, which leads to confusion with another personality disorder called histrionic, but we won't get into the differences between them. And this one is 3 times more likely to affect women than men. What are the causes? It's cognitive behavioral therapists believe that specific behavior, such as these, can be learned over time, and the processes of reinforcement, shaping, and modeling can also cause a person to have personality disorder. So if you see someone like a parent modeling these behaviors, you may feel the need to imitate them growing up. Close biological relatives of people with disorders are more likely to have these disorders, which proves that it's kind of nature as well, and genetics play a role in the personality disorders. And social relationships, such as child abuse, neglect, overly strict parenting, are all possibilities of developing these personality disorders. And that's all I have for you. So I would just like to have you review these learning targets, get them all filled out. Make sure you look at the first half of this section and fill out those learning targets as well. And I will see you back here in class. Have a good day. Bye-bye.